Hi, I'm Dr. Anjan Siotia, Director of Cardiology at BM Birla Heart Research Center. I am going to be talking about cardiac tumors today. Fortunately, cardiac tumors are quite rare. They're not something that we see on a day-to-day basis or even on a weekly or monthly basis in our clinical practice. Most of the cardiac tumors, when they happen, are benign, and by that I mean that they are not cancerous. Okay, so they are relatively safe and do not pose any threat to patient's life. Very rarely cardiac tumors can be cancerous, they can be malignant, and when that happens, most of the time these tumors are what we call secondary tumors. That means patients have got some cancerous tumor or some cancerous lesion somewhere else in the body, and that cancer has metastasized to the heart, causing a secondary cardiac tumor. But as I said earlier, most of the time cardiac tumors are benign, and the commonest benign tumor of the heart is something called a myxoma. It's a benign tumor and it can happen anywhere in the heart, but the most common site is the left side of the heart, in the left atrium, to be specific, in the interatrial septum, which is like a small membrane separating the two top chambers. The symptoms can be very variable and it depends on the location of the tumor. Patients can at times be completely asymptomatic, so there may not be any symptom and they may be detected just as an incidental finding on an echocardiogram. Sometimes these tumors can cause symptoms like palpitations, like breathlessness, like a low-grade fever. And the test to detect these tumors is usually an echocardiogram or sometimes a cardiac MRI. Depending upon the site of tumor, type of tumor, the only treatment that we can offer to most patients with such lesions is cardiac surgery. The surgeon can usually remove most of the benign tumor with an open heart surgery with little or minimal risk. If the tumor is cancerous, then it's usually, as I said, a metastatic cancer, and then the survival is very poor, and in most cases no treatment can be given. Very rarely there can be a primary tumor of the heart which is called sarcoma. They are extremely rare and we hardly see them in our clinical practice. Again, if that happens, the long-term prognosis of the patient is very poor.